ancient Chinese cultures, a bulbous tip means wealth and fortunes. So some patient may come to me, well, I want a bigger nose, and I would tell her or she that, oh, it's not. I don't think it's a very good surgical goals.
Ladies and gentlemen, welcome to another episode of the Rhinoplasty podcast with me, Dr. Cameron McIntosh. We have a very special guest today, all the way from Taipei in Taiwan, none other than Jeremy Chih-Wen. Jeremy, welcome to the show.
Hi, Cam.
It's great to have you here. So I'm just going to kick off firstly with the listeners. Guys, again, this month, our first month of season 2 is brought to us by MedHold. So a shout out to MedHold. Thank you very much for enabling us to be able to present this podcast to more than 70 countries around the world. You might look at me and think, why do I not have my scrubs on? So the reason I don't have my scrubs on is I underwent some elbow and shoulder surgery early in the week. So I can't get my scrubs on. So that's why I'm like,
oh, wow. Hope you get well soon.
So thanks, Jeremy.
Yeah.
Now, let's kick this straight off. Tell me your story on how you first got into medicine, and then from there you specialized to eventually become a leader in Asian rhinoplasty.
Well, actually, I think there are many good surgeons in Asian countries, and I don't consider me as a leader of it. And I think for these years, I devote myself in this kind of surgeries for more than 20 years. And I also devote myself in promoting the rhinoplastic surgeries in Asian countries. And I try to establish the system and or the organizations related to this operation. So I really like it.
And tell me, did you do training after you became a doctor? Did you then specialize in plastic surgery or otolaryngology?
Well, I'm an otolaryngologist in having surgeries, and I'm also a rhinologist. And actually, in my hospital, I'm in the tertiary medical centers, and I have to deal with those patients with, for example, nasal sinusitis or sinonasal tumors or the frequent disease like nasopharyngeal carcinoma, which is popular in Southeastern Asian countries.
Yeah. We had a great chat last week with Richard Harvey. He's also very into rhinology. That was very interesting. So my brother lives in Taiwan, and he's told me I've been to visit him twice, with how modern your country is. So if you could explain to us, because we've got listeners from Central Africa, right, to Scandinavian countries. How does the system work in Taiwan? Do you have a private healthcare system and a state healthcare, or how do patients actually end up getting a rhinoplasty from you?
You mean the way that the patient get me?
Yes.
We have national health insurance actually, but it only pays for those who suffer from traumatic nasal deformities, and for those cosmetic ones, they have to pay by themselves. So they may come to my hospital directly, or they may be referred from other doctors, from plastic surgeries or from ENT surgeons.
And how many doctors work in your department?
In my department?
Yeah.
Well, we got 20 visiting staff and 21 residents.
That's almost as many as we've got residents in South Africa. So, and that's just in one hospital there. Yeah. And what made you decide to go into facial plastic surgery?
Well, because I like these operations because it's a combination of doing surgeries and being an artist and being an architect, and also sometimes a psychiatrist, actually.
Yeah. Now, Jeremy, another thing that's quite interesting, I know you 2 years ago, just as COVID hit, we were due to have the International Federation of Facial Plastic Surgery Societies, and you were running that. Tell us a little bit more about your involvement on an international level for the Facial Plastic Society.
Well, I'm now the vice president of International Federations of Facial Plastic Surgery Societies, and the World Congress of this meeting is hosted by varying countries every 4 years. And last time it was 2012 in Rome, and 2016 in Brazil, and so 4 years later in 2020, I bid for the host of this conference, and it becomes our dreams come true, actually, because it is the first time that this kind of World Congress was hosted in Asia countries.
That's brilliant. Well done. And where is the next conference going to be?
Well, it's going to be hosted by Dr. Roxana Cobo.
Some in Colombia. That's great. And
Yes,
tell the listeners, what exactly is facial plastic surgery? Because I know in South Africa, for example, it's not really known, but in Europe and in North and South America, it's quite well known. Is facial plastic surgery like a subspecialty in Asia as well?
Yes, but not in every country, actually. In Taiwan, it becomes a subspecialty of ENT surgeons during past 15 years. And that's what I'm working on it, because before surgeons like me or other pioneers in Taiwan, we don't have this kind of subspecialty in ENT field, actually. But that is related to historical issue, because in ancient times, Taiwan was a colony of Japan, actually. Mm-hmm. And Japanese ENT surgeons didn't do this kind of surgery, actually. And even nowadays, only seldom ENT surgeons in Japan do this kind of facial plastic things. And that make the development of the subspecialty of facial plastic surgery in ENT department a little bit delayed in the past 60 years, actually.
Wow. But you guys have to understand there are fellowships available in Taiwan that even international delegates can apply for.
Yes, you can apply. Young surgeons can apply through the platform of international federations. But for the situations in Asian countries, only a few, not so many, doctors were in a kind of teaching center, actually. Mm-hmm. Some were a combination of private practice, and the training system is not well formed as those in the States, like a formal fellowship. Mm. But we have this kind of training systems in major teaching hospitals and some good private clinics.
Awesome, man. Okay, so Jeremy, I know we want to get into the topic of Asian rhinoplasty, but I have 2 questions for you before we get there.
Sure.
I want to know, what was the single worst day in your career, and what was the best or funniest day in your career over all these decades that you've been doing what you do?
Well, funniest things. I would like to talk about something like a culture related to culture, different cultures, actually. For example, some patients may seek for this very special kind of nose that they want, because in ancient Chinese cultures, a bulbous tip means wealth and fortunes.
Wow.
So some patient may come to me, well, I want a bigger nose, and I would tell her or she that, it's not, I don't think it's a very good surgical goals. Yeah. So we will have to have some more communications go throughout this kind of consultations.
Yeah, that's so interesting. I mean, because we always see, I've got a bulbous tip, make it smaller, but that's so interesting.
Right,
wow.
Right. But only for middle-aged guys also. For young guys or young girls, this kind of situations is getting less and less.
Wow, that's so insightful. So, okay, so for example, myself sitting in South Africa and doing a handful of Asian rhinoplasties. What would your most important advice be? Maybe 4 or 5 points that you would like to share with colleagues around the world when it comes to Asian rhinoplasty?
Well, I think there are three major difference in while you're facing Asian patients. The first one is that patients from Asian countries, they need some more augmentations than reduction things.
Mm-hmm.
For example, they may not have good profiles, but only very few of them have got hub nose. So many of them need to increase the height of the nasal dorsum through augmentations. And the second one is that many of the patients from the Asian countries got thick skin, actually, as compared to those thin skins in Western countries. And the third thing is that the cartilage, the septal cartilage, and sometimes the auricular cartilage is not large enough for using the allograft that we need in our operations.
Okay, well, there's a lot of similarity there between our African noses as well, with the not very well projected thick skin and little cartilage. So those three things, how do you deal with that? So let's talk about that first one in terms of an underprojected or a low radix. What do you do?
We do much augmentations in our practice. And for myself, I use autologous graft only, but many of my colleagues in Taiwan use implants, like celastic implants or sort of chimeric implants that combine the celastic and med pores or pure med pores or Gore-Tex or things like that. Many of them
do you
use
still, med pore,
implant.
because often at all our congresses, it's like the most graphic slide is the med pore that is now protruding through the skin, and what a disaster it is. Yet people are persisting in using it. Eh?
Yeah, right.
So you normally use autologous rib from the same patient?
Septal cartilage, auricular cartilage, or coastal cartilage.
And then how do you actually, technically, how do you build up that dorsum?
Well, sometimes with a whole block of the coastal cartilage or combinations of layers with septal cartilage or auricular cartilage, or sometimes if they need only a little touch up, maybe I will use crushed cartilage, either from the septums or the auricle.
Okay. And do you sometimes use glue, fibrin glue as well?
Fibrin glue? Sometimes. If I do endonasoplasty, if I do endonasal approach, and for some cases, it's very difficult to have a good fixations among the uppermost of the graft. Then I will use glues.
So before we get to the thick skin, I'm very interested to know, preservation rhinoplasty is like the flavor of the day at the moment. But preservation rhinoplasty and Asian rhinoplasty, does it have a place for that or not? What are some of your views about that?
Yes, it does. And for examples, we still got deviated nose, the bonival deformities, and you can use those skills that, for example, described by Dr. Dean Toriomis, the preservation ways of doing the hump and making the deviated nose straight. And you can still use that on Asian patients. That works.
Awesome. Well, that's good to hear. So tell us a little bit more for the listeners in terms of What are some of the pearls with dealing with a thick skin patient?
Well, the first thing is that you have to make sure all your structure is well corrected, well fixed, and well established. By doing this, you can have a very good framework of all the bony and cartilaginous structures. And by doing this, you got the chance to overcome the thick skin.
Okay. When we were off air, you were mentioning about that we do a lot of psychological surgery in many ways. So there were two things I wanted to ask you about. The one was, as a young surgeon, if somebody comes into the practice and they request a rhinoplasty, most of the time the patient's going to get the rhinoplasty. But the older surgeons I speak to, it becomes less and less apparent that you're actually going to get the rhinoplasty because they've now learned who not to operate on. So what are some of your comments around that in terms of how many patients who end up making an appointment to see you actually finally get an operation? And what are the dangers that we should be looking out for?
I mean, the percentage?
Yes.
Well, because I do many revision cases, and for those referred cases, about 80% will go into surgical procedures finally. And for those for the first consultations or they just came to me through the introductions of their friends or their families, maybe about 60% actually.
Wow, eh? That's a lot. But I mean, it's interesting that not everybody who comes to you is going to get the operation.
No, actually.
Okay, then let's chat about the issue of the lack of septal cartilage. Now, what we're busy looking at an international study with Miguel and looking at a few different ethnic groups around the world. What we find in South Africa on an African nose is that there's very little septal cartilage. But what I'm trying to figure out is that just the septal cartilage that's less, or is the bony septum also less? So we're doing a lot of cone beam scans and looking at this before. What are some of your thoughts around septal cartilage, where you might have to go for a rib, to the listeners?
For the first questions, I think both the bony septums and cartilaginous septums is much smaller in our population.
Mm-hmm.
And for the second questions, once the patient needs much more projections of the tip, but he or she has only a little bit of the cartilage, then I'll think about harvesting coastal cartilage for doing the strong support of the tip structures and to do the increasing the projections through the septal extension graft.
So that was what I wanted to ask. So septal extension graft would be your workhorse to try and improve the projection.
Yes, it is very important in our patients.
That's and there's so many things I'm thinking of as we're talking about it. In terms of training in Asia for rhinoplasty, are there quite a few courses available? I mean, because we sit on the other side of the world. I mean, you hours and hours ahead of us. What are some of the resources that you would advise? I know you've written some books, but in terms of somebody who's kind of at the beginning of their career and they want to improve, what would some of your advice be for them?
Do you mean in Taiwan or in Asian countries?
Both in Taiwan and in East Asia, as it were.
Well, in Taiwan, we get regular courses hosted by our academy, the Taiwan Academy of Facial Plastic and Reconstructive Surgeries. And plastic surgeons in Taiwan also have some good programs, actually. But we will emphasize on the functional part by doing this kind of procedures. But in Asian countries, there are many good courses actually. For examples, the very famous Korean programs like the Asan Medical Center.
Mhm.
Dr. Yongju Zhang hosted the Asan Rhinoplasty courses every year, and it is almost about 20 years
Yeah.
from the very beginnings. And the other courses like the Rhino Mama in Philippines, hosted by Dr. Andura Yap, and some other courses like in Singapore, hosted by Sandip and other colleagues. They invited many guest speakers from all over the world, and they made it an 11 days courses in recent 5 years, and that's really good.
Yeah.
And I think there are more and more programs or conferences in Asian countries, and it's very convenient for people from the world who wants to get familiar with this kind of Asian patients. You get many choices.
Yeah. Well, all three of those names you mentioned are going to be interviewed later on in the season of this Rhinoplasty podcast. So it's
That's
exciting.
good.
It's really
Yeah.
nice to see that. So the first month of season 2 is the East Rises. And I really feel that in a way, over the last few decades, it's been dominated by like Western surgeons in many ways. So it's exciting for me to be able to speak to you guys. How does somebody who would like to come and perhaps visit you, is there opportunities for a visitorship or an observership to come to Taipei and see what you do?
Well, the laws here they allow only observership actually, because once you want to be get involved in the surgeries on the real patients, you need the medical license in
Yeah.
Taiwan.
But COVID has been terrible in terms of locking down the country. It's been really hard to come in or come out of Taiwan, as I understand.
Right, actually, yeah. So far, because of the pandemic, it's not easy to overcome this kind of situation.
Okay, so I have one of my last questions I want to know a bit more about is silicone implants in the nose. And I have this bias where I've come, again, it's MedPaw and silicone implants. When they want to show gory photographs at congresses, it's about this implant that's extruding out the nose. However, there must surely be merit in it as well, because it's been used so much around the world. And perhaps in our African population, there's a lot of requests for try and please augment my nose, make the dorsum a bit bigger, give me a bit more projection. That possibly a silicone implant is a much quicker way of doing it. But what are some of your thoughts around that?
Well, it is very popular because it is the procedures are cheap actually as compared to those with autologous graft, and for the surgical times it is much shorter while you use an implant. But there are just some there do have some problems. For examples, you just mentioned about creating a projection of the tip with the celastic implant. I think it's very dangerous because some surgeons use L-shaped celastic implant to push up the tip directly to increase the projections, but it will have very strong compressions over the skin that covers the tip. And as time goes by, sometimes it will goes like extrusions or some dermal defect. It's terrible. And many colleagues try to use autologous graft, doing like shield graft or cap graft on the celastic implant. But some still have complications after this kind of procedures. So in my personal opinions, I don't think that using a celastic implant to improve the projection is a good idea. I don't like that.
Well, that's good to hear. I'm glad to hear that. So My last question for you is, I mean, the Taiwan medical system is possibly one of the most advanced in the world. The way you guys handled the whole COVID pandemic, just it's astounding. And I wish the World Health Organization would actually recognize you guys and see what you do. So in that context, my question for you is, how do you, where you guys are very technologically advanced in medicine, see the future of rhinoplasty going over the next, say, 10 or 20 years from now?
Well, I think in the futures, tissue engineering would be a very possible and achievable goals of our next generations. And also, I think people all over the world like minimal invasive procedures much more than real surgical procedures. So some people here in Taiwan or in Asian countries, they try to use fillers for the augmentations, but some causes vascular compromise and resulted in difficult complications. And I think in the futures, good fillers with less complications might get their place in those patients who need augmentations. And also, my dream is that if there is a kind of designs that could directly change the framework of the nasal structures, for example, before some surgeons use laser to change the curvature of the septal cartilage. I think these kind of designs could be a possible dreams for making our surgical procedures more interesting.
Wow. Okay. So the last question I want to ask you: when we are making a nose smaller, we may be deprojecting and we change the rotation. It's normally relatively easy to see your results on the table of how it's changed from your pre-op. However, when it comes to actually doing the opposite, where you're now actually trying to project and build up the dorsum and possibly build a bigger nose, that's the challenge. So when you are in theater or the OR, do you have photographs up of what the patient currently looks like and what your result is, what you're hoping for? Or how do you judge that? Because it's so hard to get the science and art together in rhinoplasty to get a good result for that patient.
You mean in OR?
Yes.
Not in office?
No, in OR.
Well, sometimes I use I measure the height and the projections with objective measurement, but many times I just judge it by the feeling. Yeah, because you can see directly the very significant change after our procedures.
That's fantastic. Sure. Jeremy, it's so interesting for me to talk to somebody who's sitting on the other side of the world, and hear these things that you had to say. To think that a bulbous tip is actually a sign of wealth is very interesting for me.
Right.
Yeah. So, guys, for all the listeners around the world, thank you again for tuning in to another episode of the Rhinoplasty podcast. We'll be back again next week with a very interesting chat as well. I want to give a shout out to MedHold again for bringing this program to us, and especially a thank you to the Vice President of the International Federation of Facial Plastic Surgery Society, who's taken a Sunday night off to record this podcast with us. Jeremy, thank you so much, and I really hope that this year would be a fantastic year for you in your practice in Taipei.
And I want to thank you, Cam, for your great enthusiasm about promoting rhinoplastic surgeries. And your great efforts into integrating the family of facial plastic and reconstructive surgeons. I really want to thank you for the great job you have done. Thank you, Cam.